Hello, and thank you for taking time out of your day to learn more about HealthiestYou, why it is such a valuable benefit, and how members are using it on a daily basis. So the main goal is to reduce health plan claims by improving the way you access and utilize healthcare. So when members utilize HealthiestYou, there's actually no claim that goes back to that All Savers insurance plan. So how are members utilizing the service? Here's a quick study by the Wellness Council of America that over 70% of face-to-face visits, so ER, urgent care, primary care physician, over 70% of those visits can actually be handled safely and effectively over the phone. And here's another study. This is the top 9 reasons we actually go to the emergency room on a daily basis. And you'll see here that there are things we can almost diagnose ourselves, right? It's allergy season, flowers are in full bloom, I know I need that prescription strength allergy medicine, or sinusitis, strep throat, and so on. So oddly enough, these are the top 9 reasons our members call HealthiestYou on a daily basis. So again, the goal is to redirect these types of visits to HealthiestYou. So we're going to learn more about care, and I feel like we're all guilty of it, right? We either wait till it's too long, or we just go to the pharmacy because we don't want to go to that primary care physician and try to find over-the-counter medications. So here's a study in 2014 that patients actually had to wait an average of 18 days to see their primary care physician. And if they do get into their primary care physician, there's going to be that consult fee incorporated with it, along with that claim that goes back to that All Savers insurance plan. So say you can't get in and you really need to go see a face-to-face doctor. The next option is going to be urgent care. So there's wait time incorporated with that. There's travel time incorporated with that. Also a consult fee and a claim that's going to be back in that All Savers insurance plan. So for this example, let's say urgent care is closed. They're not a 24/7 urgent care, or there might not be one in your area. The next option is going to be the emergency room, right? So there's a very costly consult fee incorporated with that typically, along with a very large claim back in that All Savers insurance plan. And then it's probably not going to be a very fun experience, very time consuming, and a lot of wait time incorporated with that, along with travel time. So the goal here is to put HealthiestYou front and center, right? If it's not too serious or an emergency, we want members to pick up the phone, call one of our physicians. They can diagnose, treat, and prescribe over the phone for no consult fee, no claim, and these physicians are available 24/7, 365. And again, that study that we saw earlier, over 70% of those face-to-face visits can be handled safely and effectively over the phone. So we want our members to start with HealthiestYou. So who am I speaking with on the other line, right? Who are these doctors? So these physicians are actually licensed and reside in the United States. They go through a strict NCQA certification. Again, they can diagnose, treat, and prescribe. And then you'll see there it's the largest telehealth network in the country. So there are 2,300 doctors currently waiting for members to call versus members going to those face-to-face visits, waiting on the physician. And then you'll see there that services available in 48 states. Currently, Idaho and Arkansas are just reviewing telehealth as it evolves so quickly. Then on the bottom, again, we want to redirect those 70% of consults to HealthiestYou away from that All Savers insurance plan, and essentially saving members a substantial amount of time and money at the end of the day. So this is going to be a start to finish consultation, what it entails, and what the process is. So you can call and access HealthiestYou with a smartphone application now, an online portal, or also just dialing an 866 number. So say you call and you do that. The first time members call, they'll be asked to provide some medical history. And these are things we typically fill out when we go to the doctor's office for the first time. What am I allergic to? Am I currently taking any medications? Have I recently had a surgery? And so on. And then at that time, you'll actually select the pharmacy that you would like your prescription sent to. Then the next step, you'd be scheduled with the appropriate doctor. So more about the appropriate doctor. If you connect with a physician, they'll be licensed in the state that you call from. So if you're at home in Texas, you'll be connected with a Texas certified physician, or if you're traveling and enjoying the beaches of Hawaii, you'll be scheduled with a physician from Hawaii. Then more about the appropriate doctor. If you're calling on behalf of your child, we'll get you connected with a pediatrician. We have ear, nose, and throat doctors. We have OBGYNs and many more specialty doctors. But about 80% of them are going to be ER doctors. So they're handling this wide range of things on a daily basis. And then the physician is actually going to review your online patient history. They'll give you a call back. So during that call back, they're going to walk you through, give you the diagnosis and consultation you deserve, ask you, a series of questions, and then they're going to get the prescription over to the pharmacy of your choice if they see that it is fit, or they'll direct you in the right care that you deserve. So next, that physician is actually going to update the electronic medical records per the member's discretion. So we want to share those notes with the primary care physician and keep that continuity up because we don't want to replace the primary care physician. So the next, those consultation notes would actually be stored in your member portal along with the smartphone application that we'll look at here shortly. Here's a quick couple survey numbers. 97% of our customers are satisfied with this valuable benefit, and then 94% of them are actually getting their issues resolved over the phone. So these patients are calling in, speaking with a doctor, not leaving work, even calling from the comfort of their own couch or whatever it may be at home. Then here's the average callback time. So I want you to remember back to that slide with the primary care physician, the urgent care, and the ER. The travel time incorporated with that and the wait time, and then the cost, right? 9 minutes average to talk with one of our physicians. A lot of commutes to primary care or urgent care, it takes more than 9 minutes alone. So just a substantial amount of saving time at the end of the day for that. And then also saving money, right? We want to redirect those claims away from the All Savers Insurance Plan because, again, when you connect with one of our physicians, there are no claims and no cost. So here's a member fulfillment. Everyone probably should have already received the HealthiestYou card since you are active. And the HealthiestYou card is more of a reminder. As long as you have that 866 number in your phone, I would definitely recommend to input it as a contact, just so when you do get sick, you're not searching for that number. You can just scroll down and select that number or download the smartphone application as well. So here's the smartphone application. There is a lot of useful tools in here. You can input your insurance plan. You can see your real-time deductible. You can also view physicians in your network. So if you do need to go have a face-to-face visit, you can view the ratings of the doctors in your network by using the smartphone application. Or if you simply just want to connect with one of our physicians, you could go on there, very streamlined process to utilize HealthiestYou and connect with one of our doctors. Then lastly, again, there's 3 ways to connect. You can call 866-703-1259, go online to that member portal, or download the smartphone application. You can search it on either app store, HealthiestYou, all one word. It's never been easier to access and utilize healthcare with HealthiestYou now. If anybody has any additional questions, please feel free to email us. The email is going to be clientsuccess@healthiestyou.com. Again, that is clientsuccess@healthiestyou.com. And I want to thank everyone for taking time out of your day to watch this webinar, learn more about this valuable benefit and why it is a part of the All Savers Insurance Plan. Thank you again and have a great day.